Chest x-rays, knee x-rays, and shoulder x-rays are also the most common x-ray orders put in incorrectly by registration. Wrong orders will also result in decreased productivity and also decreased reimbursement in our hospital. Next, I will talk about an overall timeline for my project. Over a 4-week time period, I have tallied and measured the 4 most incorrect x-ray orders that I discussed that are put in incorrectly by registration and central scheduling. I will provide an educational course for registration and central scheduling by setting up a date and time to do so that best fits everyone's schedule. I will do this following receiving buy-in from registration and central scheduling management and also the registrars themselves. I will also finally reassess the statistics of wrong x-ray orders after my educational class after a 1-month time period. I would really like to see how x-ray orders have decreased over this 1-month time period and see if the statistics have decreased and there are more insignificant findings with the results of x-ray orders put in incorrectly. A huge part of my project is providing this educational course for the registrars. This is an example of the registration tip sheet that I will provide for registration. It includes the name of an x-ray exam and the number of views. For example, for chest x-rays, there are many different ways to put in chest x-rays depending on the order. Sometimes it says CXR, chest x-ray 1 view, 2 views, or chest x-ray for TB screening. I would like to convey to all the registrars the difference in how to put in the x-ray order and how many views are included. I will provide a registration tip sheet to all the registrars. This is a handout that I will provide for them. This is the tip sheet, which in this box will explain the name of the x-ray, and in this box it will explain the number of views. And this is a list of all the most common x-ray orders that we provide for outpatients, and this will hopefully really give them a better understanding of all the different x-ray orders and how many different views we need to have ordered for each patient. Every x-ray order is different that is put in by a physician, and I would really like to educate the registrars a little bit more of x-ray in general, and I hope this will increase their awareness of how important putting in the correct order is, and it affects patient care greatly, and also I would like to provide information with how it affects teamwork as well. The quantitative metrics and benchmarks for this project include the 4 most incorrect x-ray exams ordered by registration and central scheduling. These again include the hip x-ray, chest x-ray, knee, and shoulder x-ray. Following the educational class, my goal is to really reduce these incorrect orders to insignificant statistics. Reducing orders that are put in incorrectly will increase patient satisfaction by reducing wait time for patient and increasing teamwork in the workplace. I have made a pie graph, which is a representation of the percentage of the most common incorrect orders over a 4-week period. From these 4 x-ray orders, with 100% altogether, the most common is the hip x-ray at 38%. The next most common incorrect order is chest x-ray at 29%. Then the knee x-ray at 18%. And finally, the shoulder x-ray at 15%. Now, these are the most common x-ray orders that you can see here in this pie graph. But there are also many other orders that are put in incorrectly. Some of the most common, other common x-ray orders that are put in incorrectly include obscure orders like the scoliosis series. A lot of times registration will be unaware of what a scoliosis series is, and they will instead put in a spine x-ray order, which they usually put in cervical, thoracic, and a lumbar spine instead of ordering an actual scoliosis series. This is another aspect of radiology that I would like to educate registrars of, just giving them a basic understanding of what these different x-rays are. A lot of the times we also receive orders that include an upper extremity or a lower extremity. In these cases, I would like to educate the registrars in that they would have to actually call the physician of the patient to specifically receive what x-ray they would like for their patient. We cannot just assume that an upper extremity means a hand x-ray or a lower extremity means a foot x-ray. We need a specific order of if for upper extremities it's shoulder, humerus, elbow, forearm, hand, or even fingers.